Next case I would like to show you, I will call from the edge. This is a patient who came in with mitral regurgitation for just a routine checkup. We know that he has mitral regurgitation, so this was not a surprise to us, but I still want to show you something which is very interesting and which you should be aware of when you perform echocardiography. So here we have, wait, let me go back, yeah. Here we have the parasternal long axis view. The aorta in this case is of normal width, maybe just mildly dilated. We have left ventricular hypertrophy. The left ventricle shows normal left ventricular function. The aortic valve looks just the way we would expect it from an 82-year-old. It's not completely thin. It has focal fibrosis, but certainly no obstruction, no stenosis, or no big problem. What about the mitral valve? The anterior leaflet, the posterior leaflet looks quite normal. Okay, so now we know the patient has mitral regurgitation. The question will be, well, why is this mitral valve actually incompetent? And if we use color flow, you can see that there is significant mitral regurgitation. Let me just play this slowly so you can appreciate the size of this jet. Right, so that the jet is going fairly eccentric down here towards the posterior portion of the left atrium, and we have a fairly large flow convergence zone. So there is a lot of mitral regurgitation, but where is the problem? Here is the four-chamber view. Let me just focus this out for you. Right here you will see the mitral valve, which looks pretty normal. Again, we have a bit of thickening, sclerosis, not even much mitral annular calcification. So why is this patient having mitral regurgitation, and where is it coming from? Let me give you another image. This is a two-chamber view. The left ventricle is dilated, and we have hyperdynamic left ventricular function, which fits quite nicely to the volume overload that we would expect in patients who have significant mitral regurgitation. Okay, so does anybody see a pathology here? Okay. Now let me give you the color Doppler. And here you will see the jet. Again, a very large regurgitant jet. The five-chamber view in color, again, a large regurgitant jet. This is just a close-up view. And one more view, and then I will ask a question. Apical long axis view, just more again here. Looks pretty normal, the valve here. And now we will put up the question for you. Where is the origin of mitral regurgitation? Those of you who are in the masterclass and who've gone through the chapter on mitral regurgitation might already know I've covered this topic, and it's an important topic. The topic of how can we evaluate the origin of a jet. This is an important information because after all we want to give this information to the surgeons because the surgeons want to know. We'll help them decide not only if they can repair it, but also how they can repair it. Okay. Are you seeing the poll here? I guess we have a little technical problem here. Well, I will give the answer to you. Let's not waste time. Well, the answer is the patient has a defect right here in the anterolateral commissure of the mitral valve, right at the edge. This is the defect here. Now, how can you determine where you are? This is a two-chamber view, and if you take the two-chamber view, you have different portions of the mitral valve. The portion right here, close to the anterior wall, is the anterolateral commissure. The portion of the mitral valve right here in the middle is obviously the middle scallop or middle scallops. And this region here would be the posterior medial commissure. Now you cannot say if you have a defect of the anterior or the posterior leaflet here. Excuse me. The only thing you can say if you are more in the anterolateral or in the posterior medial regions. And even on the 2D image, you can appreciate that there is something going on here, that there is some kind of defect located right here. Now, there's also other ways of looking at this. If you, for example, use the 4-chamber view, excuse me, I guess it is so cold in here, I already caught a cold. Okay, but this is the 4-chamber view, and here you would be right through the middle of the mitral valve. So this would be the medial scallop of the anterior leaflet, and this is the medial scallop of the posterior leaflet. We don't see anything here. No surprise, because this is not where the defect is. If you scan in a 5-chamber view, let me see this here. If I can get a 5-chamber view without color, let me see where one is. Okay, I can't find one now. But if you use the 5-chamber view, in the 5-chamber view, you are more towards the anterolateral commissural region again, and this is also why we see the regurgitant jet here. So by simply taking the transducer from a 4-chamber view to a 5-chamber view, you can scan the anterolateral commissure. And if you want to, for example, look at the posterior medial commissure, you would go towards the coronary sinus view. So very simple. What does this mean for the patient? Well, at this point, probably not much, because we're not planning to operate the patient. He is asymptomatic anyway. But if we would operate him, the surgeon would know that this is a problem which is not always so easy to solve, because commissural problems, prolapse or ruptures, are usually much more difficult to operate on. Okay, now to the next case. Oh yeah, this is just a diagram which shows you what I just displayed. This is the mitral valve. This here would be the anterolateral commissure. This is where we had the problem, which is kind of in close proximity to the aortic valve. So this kind of helps you. The aorta helps you to see which part of the mitral valve you're actually imaging. So in the 5-chamber view, you would have the aortic valve and also the anterolateral commissure. And then we have the typical Carpentier classification with anterior and posterior leaflet. A1 would be anterolateral, A2 would be medial, and A3 would be posterior medial part of the mitral valve. Okay, and in our patient, we had a jet which came right from here, from the commissural region. You can also display this in a short axis view. Now, this patient did not have such a nice short axis view, but if you use this view and you use color, you cannot really quantify the degree of mitral regurgitation, but you can see where the origin is. The jet would come either from this region, this would be the anterolateral region, or from this region if it's from the posterior medial commissure. So use these two views and they will help you.